when they come in here, I prefer that they're coming in more for maintenance because of they're competing, they're working out, they want to stay active, healthy. So one of the quotes that I usually go by, and this is something that my mentor told me, is that we go to the dentist twice a year for cleaning, even though nothing is wrong with our teeth. All we use it for is chewing, but we still go twice a year. We go to the eye doctor once or twice a year for checkups. Even though nothing's wrong with our eyes, we just use it to see, but we still have someone to check in. We use our bodies for every single little thing, and who's checking that once or twice a year?
Right.
We usually wait until I get a tear, something is broken, I have a nagging injury, then I seek some kind of care.
Right.
So I want Resilient RX physical therapy to be the first thought before that injury happens.
Tell me about this space. Why here in Clark?
Once I came in here, I fell in love with all the windows, the lights, the balcony, and the area. So in this space over here, I put the turf down, and we do a lot of like dynamic, functional stuff. So we can use different sliders just to be on the floor. I'll do a lot of plyometrics or jumps in this area, a lot of mobility drills. I work with a lot of CrossFit athletes, so I did have to open up the ceiling just to do a lot of like overhead lifts because the ceilings were so low. And again, the idea when I'm working with a track athlete or a CrossFit athlete is that when they come into their physical therapy office or their provider, it should match what they're doing outside of here. So you got a sprint treadmill or an assault treadmill. And then over here is a sled treadmill. So because I don't have the space to pull or push a sled, this one I can kind of come in here and I'm pushing through here. And I can just press a button and it'll go up to 450 pounds, right? So I can come through here. You can do things like in here and do a lot of like knee work, and there's a resistance on this. And like I said, this treadmill is more sprint or speed work.
So someone who's doing a marathon or that kind of thing?
More sprinting.
Oh. Okay.
Yeah, because it's really just like like a hamster wheel essentially. So, and it just goes. There's no speed limit.
Oh, that's
It's as
cool.
fast as you can go. Yeah, so I also do a lot of dry needling. They are acupuncture needles,
Okay.
right? So it's very similar. They are acupuncture needles. One of the differences though is I am not treating your energy or your meridians, or I don't treat different systems. So I'm not putting a needle in your ear to treat your anxiety or anything like that. I am treating purely musculoskeletal. So I put it into a specific muscle at a specific depth, whether it's the bone or a nerve or a muscle. So my focus is very musculoskeletal. I do a lot of dry needling, adjustments, manual work, soft tissue work, and a lot of education for my patients when they're here. So, biggest thing is when my patient comes is that they know how to manage and control their own pain and know why their pain is there. The space is beautiful, but also the location provides me a lot of opportunity. One, for me to be able to grow into a space. Two, I can partner with people to help grow and establish Resilient RX to be that health and wellness kind of hub.
You mentioned partnerships. You do have a partnership working out of the same facility. Tell me a little bit about that.
Yeah, so I partnered with Imprint Integrated Massage Therapy, or Elisa. So we were actually friends for a couple of years prior to partnering up. So I met her doing Muay Thai, and after she punched me in the head and tweaked my neck, and then I went to her for massage.
Oh, it's reciprocal here.
Yeah,
I see how it works.
So she was taking care of my neck, and just seeing how knowledgeable and experienced she was with her approach, it was just different than a typical massage.
Our thought process for a client was the same, which is we hold close to our heart for it to be very custom and very tailored to one person at a time and not a hamster wheel. So my goal here is for healing and for my clients to understand how their body operates. Many people don't know this is connected to that, and you're feeling it here, but also you're feeling it here, and you're like, why are you working on my hip and I feel it in my armpit? So it's just the waves and connection through the nerves that run everything back and forth. Everybody works differently. All massage therapists are different. There is a person for every massage therapist, and sometimes people are looking for something different. So what's unique about me is I'm integrated, meaning that I take a bunch of modalities and put them together to customize a session for my client. Oils are very important. Your body is soaking them up as I'm massaging you. It doesn't matter if you shower after. So it's very important to me the quality of the oil I'm using on my client. There are some chain places that don't use the best, and I'm pretty sure it's for certain reasons, but for me it doesn't matter the cost or where and how I have to get it. If it's going to benefit your body, that's what I'm here for. I gear towards medical and sports, also pre and postnatal. Have a lot of women that come in and like, I never had prenatal massage like this before, and I'm like, so tell me about your experience. So they're getting rubbed down with oils for relaxation, but these women are coming in with lower back pain, extreme anterior pelvic tilts. I want to decompress that back and let those glutes breathe for them. I mean, carrying that big belly for 9 months is taxing on the body. Also, massage just isn't for manual. It's also stimulated to the brain for PTSD, people who have trauma. Touch trauma. Usually when you have trauma, it's something that happened to you physically, and it sits with you mentally. So people do cry on my table. Emotional release on the table, it could just be because your muscles are harboring that trauma or anxiety or tension. So say we're stressed out, we're up here. Now you're uncomfortable and you're aggravated and you're sitting up here all day long, and then you come in here and I release it. People fall asleep right away, or the tears start coming out and they're apologizing for crying. I'm like, this is what I'm here for. If you get relief from this, or your mind is at ease because we had a conversation, that too. I don't rush my clients. This is custom to you. I give a certain amount of time. If it's a new client or a client I know that's going through some stuff, we'll sit here for 20 minutes. I don't want you to get on my table until you release verbally what you feel is necessary to relax here. If you get on my table and you're not in a good state of mind, that's why my room is set up the way it is. It kind of feels like a home, and people say that to me. Actually, I had somebody tell me, which was very, very kind and very nice. She said, it's like sitting with an old friend. She said, I look very much forward to coming here.
So overall, if someone's looking for therapy for whatever reason, why should somebody come see you?
So you're walking into this office, and by the end of our session, my focus is that we're so comfortable that we're able to exchange a phone number, and you can text me at any time, letting me know, hey, I'm keeping me posted on your progress, any issues. It is truly personal. And yes, you pay for the session, but that's just so I can pay rent. My focus is how you're feeling, your well-being, and I really, really care about how my patients are doing.